Hi, my name's Rachel and I'm from New Zealand, and this is my story. So I was 26 years old. Me and my husband had just got married, had a really awesome time. We decided that for our honeymoon we wanted to go to LA and then go to Vegas. So that's what we did. It was such a cool experience, awesome time. And it was not long after we got back, a month or two, they found out we were pregnant. And man, I was shocked. I was shocked to be pregnant, but we were super ready and I was so excited. Um, so yeah, after the shock was over, it was exciting time. We had our first scan. Everything went really well, and I didn't really know what to expect, but they said everything was normal, so that was cool. Went to our next scan, it's the 19-20 week scan, and that was really cool. I was really surprised to see all the spine and all the little details. Like, it was awesome. But there was a couple of images they couldn't get. They needed to get two more of the lower spine, and they'd sent us away to come back later on that day, but they still couldn't get it. She was stubborn, so she wasn't moving. So that's okay. They said just come back in 4 weeks and we'll get them then. So off we went. 20 weeks. Okay, cool. See you later. But it was over the next 4 weeks that I really sort of started to feel not right. But everyone was going, oh, that's pregnancy. But I was having dizzy spells, and these were not like a little bit dizzy. These were, I would sit up in bed and the room would be spinning so fast that it would just throw me back down onto the bed. Like, and I thought, whoa, that was like, I thought it was pretty cool. I was like, man, that is cool. I've never seen something spin like so fast before. It was crazy. Um, so I was having those quite often, and then I was getting nosebleeds, and like I've had nosebleeds most of my life, but these were nosebleeds like on another level. Um, so I was getting those, and then I was getting sort of confusion and funny moments. Like, it was pretty bizarre, but it was like, oh yeah, pregnancy brain, and it's all normal. I'd never been pregnant before, so I sort of thought, okay, don't really warn you about this crap, but that's all right. So off I trot on my regular pregnancy journey. But this was like, so we were building up to Friday was my next scan, so I was going to be 24 weeks then. So it was the day before that, and I started to get a bit confused and a bit funny that day. And I thought, what's going on? And then when I stood up at work, I went to go get something out of the boardroom or someone, and when I walked up to the door, I instantly felt like I was going to pass out. And I was like, whoa! And I grabbed onto a railing that they had there and sort of trying to hold myself up. The guy that was there was like, well, you don't look too good. And I didn't feel good. I felt funny. And I said, oh, I think I just need to go sit down. So I went and sat down, and my boss sort of said to me, or said to the people around me, just keep an eye on her. She doesn't look very well. And then I was sitting there and I was just doodling, 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 doodling. I had no idea what was going on around me. And they're like, your phone's ringing, hello. And I was just like, didn't even. And then when I could hear them all going, you're fine. And I'm thinking, oh. And I kind of snapped a little bit out of it. It felt funny. It's like, oh, I think I'm going to go home. I'm not feeling very good. So I went home. So I went home and just went to sleep and said to my husband, yeah, it felt funny, a bit confused, kind of like I was in the weekend, and not very good. Started getting headaches and stuff, so I was like, just gonna go home. So anyway, rested up, and then the next day woke up normal, dizzy spell, whoa, everything was going crazy. Got over that and went off to our appointment. It wasn't until we were getting scanned at that appointment that I could kind of tell something wasn't right. She sort of was like, oh, okay. And I said, oh, what's going on? She said, oh, that the baby hadn't grown much since I last saw her, and that the Dopplers, which is the blood flow going through the cord, She said it's quite low, it's quite sluggish. And she said, baby's, heartbeat's fine and things, but the growth is no longer on track. And she was concerned about the blood flow. She was able to get the image of the spine, but it was no longer a priority. So she said, I need to contact your midwife. Don't go back to work today, just go home and your midwife will contact you. I sort of had no idea what was going on. And I thought, okay, all right. So just went home and waited. And the midwife contacted me and said, she's made an appointment for me to be go through fetal medicine. So I'm from Christchurch, New Zealand, and the Christchurch Women's Hospital have fetal medicine department where sort of high risk patients get put through to. She said I'd still be under her care, but I'd also be under the care of fetal medicine. We were due for our monthly catch up in New Zealand, when you catch up once a month to start with until you get closer. And we were due for our monthly catch up on Monday, but she said you'll be at the hospital on Monday. They'll rescan you. So she said we'll leave it and I'll give you a ring after that as to what we do. So we were no longer going to have our catch up on the Monday, so that was fine. So I thought, oh, okay. So I wasn't really sure how serious everything was or what was going on. We had a few things on that weekend, so I felt okay, just my usual crazy. Yeah. So went out on Friday night, and my husband had some work drinks, went out and had that, but I kind of got a bit of a headache, so I went home. Saturday night we went out, it was a mate's birthday, had drinks, well, everyone else had drinks. Me and another friend who was pregnant at the same time, we were sober driving. We ended up in Littleton from memory. Ended up being a late night, but a good night. And then Monday came round, went into the hospital, was scanned. Yep, they confirmed growth is not on track. Baby was still okay. The blood flow, yep, it was low. So they said to me that you should have 3 lines of blood going through the cord, and I only had 1 working. So they kind of showed me a little bit about that and what's going on, and we were introduced to the NICU team, to the neonatal intensive care team, and talked through what would happen if she was born, what her chances would be, which are not very high. Oh, by the way, I found out we were having a girl. And then we got put through to like a counsellor or a social worker. It was just like, how do you feel? Yeah, which I didn't know how I felt. Like, I didn't really know what was going on. So I didn't really know how to feel, but I knew that modern medicine, they should just be able to fix whatever's happening with baby, and we'll keep going. So Tuesday they wanted me to come back. So on Tuesday I went back for more monitoring. Basically they were just monitoring the baby. So I went on the ECG or whatever it's called. They listened to the baby's heart rate. Took a big long recording of the baby's heart rate. I don't think they re-scanned me that day. And then Wednesday they said they were going to have a meeting. So they have a round table meeting at the hospital with fetal medicine, the NICU team, and they kind of just discuss some of the tricky cases that have come through in the week, and see as a group how they're going to move forward, I guess, on any of these. And she said that they'll be discussing my case there. So that was fine. And then it was at that case that they discussed the baby and said, this is what's happening with the baby. It wasn't until I believe it was Bronwyn, who actually said, she's one of the NICU doctors. She actually said, okay, so that's what's happening with baby, but what about the mother? Has anyone checked the mother? And they sort of thought, oh, and they started to go through my files and everything and realised that, nah, nobody's checked me. So they thought, oh, well, let's see what the midwife has been checking. So they contacted her and she said, oh, I haven't checked her since the 20-week check. She was due to meet with me on Monday, but we cancelled it because she was coming to see you guys. Did you guys not check her? And they said no, that they checked the baby, but they hadn't checked me. So it sort of raised a bit of a red flag. and they started to get concerned then and said someone needs to check this mother or this mother to be now. So the midwife, she lives on the other side of town, so it was a good 30 minutes away. She rang me at 5:30 and said, I need to come and see you now. Please just sit and relax. I need to check your blood pressure and your urine and everything and make sure you're doing okay. So I thought, okay, it's an odd time of night. We're just about to have dinner. She said, don't have dinner, just wait. So I thought, okie dokie. So yeah, she was at my house pretty quick, considering she lives on the other side of town. And then she just checked, so she got me to do a urine sample. I could only really do a small sample. I don't know. I thought, oh, am I nervous? Or I'm not sure. So didn't really do much, but enough for her to test. And she took my blood pressure, and she took my blood pressure first and was a bit funny. I could tell her voice had kind of changed, and she'd sort of gone up an octave, and I thought, oh, okay, like, what's going on here? She just wasn't as relaxed. And then it was when she did the dipstick test in the urine, and I knew then that it was not good. And she said, oh, you need to get into hospital right now. She said, don't eat anything, don't drink anything, and get Nick to help you, pack your bag, you need to go. She goes, I'll meet you up there. And she took off. Like, she said, you've got, oh no, she did say, she said, you've got, it looks like you've got severe preeclampsia. And she said, whatever you do, don't Google it, just get to the hospital. I thought, oh, okay, I've never heard of this preeclampsia. Why have I got it so severe? I've never even heard of it. What does it mean? I don't know, but I was like, oh well, they've found it. They've found something wrong with me. Great. Now they can fix it. Now they know what it is, they can fix it. But little did I know that severe preeclampsia doesn't just get fixed. So I arrived in the hospital. I was put into the observation unit, acute observation unit, I think it's called, and they were trying to hook me up to everything. So they were trying to get a drip in, but I've not got very good veins, so they had a bit of a struggle there. They were trying to get bloods, and they asked for another urine sample, but I couldn't. So I said, oh, I don't need to go, or I don't know, try again later. Didn't think much of it. They did eventually get some bloods. They got a line in, and they hooked me up to a magnesium drip, and they gave me blood pressure medications, and we're just trying to get my blood pressure down and under control. I didn't really know a lot about blood pressure and how serious it could be, but yeah, that's okay. So they were waiting for the bloods to come back, and still couldn't really give that sample. And then it wasn't until the bloods came back that they saw in the bloods that my kidneys were failing, and it's probably why I couldn't provide them a sample. And then they asked the question, have you been to the toilet today? Have you been? I'd never really thought about it, and thought, actually, nah, I haven't really. Just haven't needed to go. Like, didn't think much of it. Haven't been in any pain. Just didn't need to go. So I thought, oh, what's going on here? So yeah, it was starting to affect my organs. Pretty crazy. So from there, I was being treated for severe preeclampsia, and that was the Wednesday night. And yeah, I stayed in the acute observation unit till Sunday night, and then Sunday they shifted me upstairs. So the observation unit was on level 3, Christchurch Women's. They shifted me upstairs to level 5, which is maternity ward, bed rest sort of area. I was getting better, so yeah, it was great. They also hooked me up to a catheter, so I was able to get that out as my kidneys started working again, and yeah, it felt good to get that out. Baby was stable, no change, no growth, but no no more Doppler issues. The blood flow was still going through. No worse anyway. It was no better. So yeah, I was monitored there Monday and met a really cool nurse. Michael Jackson had just died, so his funeral was going to be on Wednesday morning on the TV. So I was excited to get up in my own room, have my own TV, not have a nurse standing over me 24/7 like in the observation unit. You're constantly monitored. You're connected to everything. The nurses are staring at you basically 24/7. So it was nice to get up and have my own space. And one of the nurses she was very cool. And we kind of clicked, and she said, "Oh, I want to watch the funeral, which was going to be Wednesday morning. It's going to be quite early from memory in New Zealand." So I said, "Oh, I'll set up an alarm on my phone to make sure I'm awake in time, and I'll program the TV to come on." So we were mucking around with the TV to program it to come on, and yeah, I was looking forward to Wednesday morning. So Tuesday rolled round, and I went for a scan. Nothing had changed, and met a lovely different nurse who said to me, "Oh, if you're going to be here for a little while," she goes, "I think we'll hook you up." And she hooked me up. Boy, did she hook me up. She gave me the mattress topper. Man, it was good. It still had the plastic on it like hospitals have, but it was bumpy like this. But oh, it was awesome. It made my bed like so good. I was like, heck yeah. So felt better. I was sitting up, resting in my new cool bed, so that was cool. And had a couple of visitors. So the visitors came and saw me, and yeah, it was one of my good friends was talking to me, and I said, "Oh, I'm getting a headache. Just a slight headache. Felt a little bit funny." She sort of said, "Oh, you should let them know." I thought, yeah, I might take something and it can just go away. So took something for that. It was actually my midwife who came and saw me, and she gave me some paracetamol to take to get rid of the headache. But she said she would let the doctors know that I was feeling different, and I said, "Oh, it's just a headache. It's only a slight headache." But she let them know, so that's fine. The doctors then decided that they would take some bloods, just a precaution. So they come and took some bloods, and I had some lunch and went to sleep. And just mid sleep, I felt really good. It wasn't until I woke up from the sleep that sort of woke up and was like, "What's going on?" There was like 4 or 5. There was at least 4 anyway. Doctors sort of standing there with their clipboards and iPads, and I was like, "Hi, like, what's going on?" And one of them said, "How do you feel?" And I was like, pretty good," because I did felt pretty good. Headache was gone. One of the other ones said, "What have you eaten?" This was the one with the chart. "What have you eaten today?" I said, "Oh, I ate lunch and I ate breakfast." "When was the last time you had a drink?" "I don't know, when I took my pain meds." Like, I really didn't understand what they were doing. Plus, I'd just woken up. So then they said to me, I said, "Oh, what's going on?" And because I thought, you guys don't just hop around like this. And they sort of said to me, "Oh, the nurse is going to pack up your things, and we're going back downstairs." And I thought, oh, what? Like, the funeral's on tomorrow. I programmed the TV to come on, so whoever was in the room after me, sorry about that. TV would have come on at like 5:30 or 6 in the morning. Anyway, they wheeled me downstairs and said, well, they hadn't really told me that what was going on, but then they gave me a theatre gown and said, "You're going into theatre." And I was like, what? They also told me to ring my husband and get him up. And I said, "Oh, he's finishing work in half an hour or so. He's coming up after that." And they said, "No, he needs to come up now." Yeah, so it was all full on, really. And before you know it, I'm being whisked into theatre. So Nick arrived from work. He finished early and came in. And he was just, I don't know what he was told over the phone, but he was just told to come in. They just handed him some scrubs and said, "Well, you're going into theatre." and off we went. We were separated from there. He was told to sit outside theatre as they give me the epidural. Um, Apparently that's 6 attempts. You're allowed 6 attempts to get the epidural in. Sounds like a lot. Doesn't sound quite right, but I'm pretty sure it was 6. So yeah, because it was the 5th attempt, it didn't work, and so when the epidural doesn't work, you get shooting pain down one side of your body, and you have to tell them what side the pain is on, so that they know how far they are away from the centre of the spine. They said we had one more attempt, and then after that, I won't be able to have an epidural that day. I would have to go under general, which I really didn't want to go into general anaesthetic because I would be completely knocked out and I wouldn't get to meet my little girl. So I was pretty determined, and so were they, to be fair, to get it, but they needed to get it quickly. I didn't really understand what all the rush was about. Yeah, they seemed to be rushed, panicky. So yeah, I wasn't too sure. But after they got it on that 6th attempt, thank goodness they got it. It was all go, and they let my husband come in, but he'd been waiting out there for quite a while. I didn't realise that he'd been told out there that we were both critical, that your wife's critical, your baby's critical. He'd already rung family just to say that, I think his parents, my parents, just to say that we're going to theatre. He wasn't really sure how serious it was. Yeah, it was all a rush. And yep, so then he wanders into theatre, sort of sees me, yeah, I've been through a bit getting that epidural right. And I think he sat down with me and sort of went, sort of holding my hand, and next minute he was having a wee rest on the floor. And I thought, oh, and so couldn't really move, but I was saying, hey, like, husband's on the floor down there, and they were sort of, oh, he's all right. And I'm like, he's on the floor. What? And they're like, he's fine. And they just carried on, and they could see, well, my midwife could see I was starting to get agitated. Like, they were just stepping over him like he was a spilt piece of ice cream on the floor. It's fine. Like, no, that's my husband. Like, what? So she said, look, I'll get him a pillow. So she went over. I'm assuming she checked he was breathing. Maybe they knew he was. I don't know. But they gave him a pillow and just carried on. So I thought, okay. And off we went. But, it wasn't too long. He was back up sitting next to me. But yeah, he was pretty pale. I think he definitely got quite a surprise with everything that was going on. There was quite a lot for him to take in, and I just was not even on this planet, I don't think. I thought I felt great. And then, but yeah, there was sort of the guy behind me, the anaesthesiologist. He was yelling out numbers, and he was 220 over 120, and just kept yelling out. And I thought, it's obviously my blood pressure. Didn't really know what that meant, but he had to keep yelling out the numbers all the time. It was always over the 200 mark, so yeah, I didn't actually realise at the time because they had not told me, but they had not told me because my blood pressure was high, and they didn't want my blood pressure to go any higher, that I was actually at risk of stroke, heart failure, and the reason that there was such a rush was the fact that my platelets, so your platelets help your blood clot, and they usually sit somewhere between 200 and 300, and mine the day before were 250, and when they checked it after I'd had that headache, they'd gone down to 80, and so that's quite a big drop. And then they checked it just before I went into theatre, and I was down to 60, so they were panicking. If it goes below 50, you can't be operated on because you're at risk of not clotting and bleeding out when they cut you open. So yeah, they were in a rush. They didn't know. It kept dropping and dropping, and they just didn't know, was it just going to drop away completely? So yeah, that was part of the rush and the hurry, was my platelets. But being pre-eclampsia, the only way to come out of it or to stop it was birth. So they had to birth the child in order to save my life, and they had to birth her quite quickly due to my platelets dropping. If my platelets dropped below 50, they couldn't operate. The birth wouldn't have happened, and yeah, well, the outcome would have been completely different. So came out of theatre, and the baby had started crying after she was born, so I knew that she was alive. And they did discuss with me and Nick when we got to the hospital that we have to sort of make a decision whose life was going to be more important. Was it going to be mine? Was it going to be the baby's? Um, it's a really, some people say it's a no-brainer, but it's not a nice position to be in. Like, everybody always says, oh, I would do anything for my child, I would take my life for my child's life. But given that given she was not a healthy full-term baby, her life survival, her chances of survival were really slim. So we didn't prioritize hers, we prioritized mine. And that was a decision that we made together. Yeah, so we said my life first, her life a very close second. We would like to give her the best chance we can, but we knew the risk were there for me as well. So that's what we did. That's what we decided, and we decided that if she was to come out and be breathing for herself and fighting to be here, then we'll fight with her and give her that chance. If she came out and she wasn't breathing and she needed to be resuscitated, we didn't want that. We didn't want medical intervention on someone so small, someone so unhealthy, if that wasn't how it was meant to be for her. So yeah, it was a decision we made together, and yeah, I don't regret it. She came out breathing, and we decided to give her a chance. So yeah, she was really tiny when she was born. She was just 1 pound, and she was instantly whisked away with the NICU team. Didn't get to see her or anything like that. And then yeah, it was probably about an hour later I was put back on the wards. I was told that I'd had a T-section and not a C-section. So a C-section is just the C on the outside, but a C on the inside where your ovaries are. And that's sort of the nicest, safest, normal way. If you have a T-section, which is a classical cesarean, is another professional term for it, I guess. It's the C-section is on the outside, so I still just had the C-section scar on the outside, but on the inside, my ovaries was a T. So they had to do a T-section because they just had to get her out as quick as possible, and due to her size, the T-section was going to be the safest method for both of us. So that's what they did, and they said to me that the surgeon would discuss it with me later, but it would mean that I wouldn't be able to have a natural birth again. Well, not that I had one in the first place, but you know, some people after a C-section can go on to having a regular birth, but having the T-section, I was at risk of rupturing anything inside me if I had a regular birth after that. So yeah, that was what our plan was going to be going forward. So didn't really care at the time. Was high on a lot of crap they were giving me, and yeah, I was put back on the wards. I'd rung some family. Well, not on the wards, I was still in the observation area. Was still actually critically unwell. So found out that I was, with the platelets dropping, it's part of HELLP syndrome, HELLP. And that's something that you can develop from pre-eclampsia. You can develop HELLP syndrome, and that was also shutting down my liver my kidneys were failing again. Yeah, renal failure basically, so platelets dropping and complete renal failure. So was not heading down a very good path and was still in a critical state after the birth, and probably for the next 24 hours. So I was closely monitored, and I know it was a bit of a crazy time. Yeah, I was tired and didn't really understand anything. Yeah, and so they brought down photos of my baby, but I was I don't know, I thought she looks funny. I didn't know what to expect, but she didn't look how I expected her to look. So, however, she was my little girl and she was fighting to be here. So, yeah, we decided that we'd give her all the chances that she could possibly have to be a healthy little girl. We named her Courtney. It was a name that I really, really liked, and decided that that name would be hers after she arrived. I think we'd made that decision that that's what we would call her. I spent the next 24 hours under observation in the observation unit before I was moved to my own private room where I had a nurse there the whole time. Hooked up to so many things. They had to get 3 or 4 drips into me. So one of them they put in my foot. So at the end of my bed, so I had the 2 poles behind me with stuff hanging off them, and then one at the other end with stuff hanging off. So yeah, they were sort of saying, "Oh, you're sort of like a Christmas tree in here." I was all lit up with all the machines lighting up and buzzing, and wires everywhere and stuff hanging out. So they wheeled me up to see my little girl the next day, but I was I don't know, I was so unwell, I could barely move. I couldn't really see her. So I sort of said, "Oh yeah, okay." But she was hooked up to so many things. I was hooked up to so many things. I don't really remember what I saw, to be fair. I didn't see anything memorable, put it that way. And then they sort of wheeled me in my bed back down. Yeah, I still hadn't got up and moved yet or anything. I was pretty much flat on my back. I know that they'd given me sleeping medication for the next night, so I would fully sleep. So Wednesday night was medicated to sleep, sedated, I guess, and had a really, really decent sleep. And the next morning, they sort of said that everything was starting to improve, that my organs were all starting to recover. So that was a nice relief. And they said I was going to move back up to the 5th floor, up to the bed rest ward, where I would continue my recovery. So that was cool. They put me in a wheelchair. I think I showered, so that was nice. I was able to get up and about and shower, and they put me in a wheelchair and took me up. I'd had Voltaren in the morning, so a little pain medication, and I hadn't eaten much. I didn't have much of a, I don't know, I was in shock. So I hadn't eaten a lot, and if you don't eat a lot and you have Voltaren, it's not a good combination. So they took me in the wheelchair up to the room, and it was when I got up there, I said, "I'm going to be sick, I'm going to be sick," and just threw up. The nursing staff on hand went and got me a sandwich. I said, "I just don't think I've eaten enough." Got me a sandwich, and then that was it. See you later. And I was in this room going, "Okay, cool. So now what?" Decided to be wheeled down to see my daughter. So off I went, wheeled down there, and really got to see her the first time properly. Yeah, it was interesting. Nick was great with her. He'd been helping with her cares, helping do things like they get you to take the temperature. She's just holding the wee thing under her arm, holding her arm down until it beeps. They put Vaseline on the skin because the skin isn't developed enough to keep its own moisture, and just changing the nappy, but she was so small, they just had this tiny little nappy out underneath her, so it was just swapping that over. Just being really gentle. They wanted me to do it, but I was freaked out. There was no way I was touching her. I was far too scared. Thought I was going to break her. I just was no way. So yeah, I sort of left that up to Nick. And I was almost like, I didn't want to get too attached to her, because I was like, I feel like this is not going to end well, and I don't want to put all my emotions and all of my heart and soul into this little girl and have it go bad. I just already was not in a good headspace. Didn't want to make it worse, so that was that really. I found it really weird being back up on the 5th floor. I just felt it was different this time. Like, I guess I'd had the baby, and I guess I was presumably out of the woods a little bit. That you had to push the bell to get a nurse, and yeah, they were quite busy up there by that stage. There wasn't many beds left anywhere, and I don't know if they were short-staffed or if that was just the norm, but it took quite a while for a nurse to come once I paged them, so it was just a little bit, yeah, I found it quite tricky getting in and out of bed. I was quite sore. I was actually very, very sore, and I didn't realise that I was probably a bit sorer than most, because I had the classical cesarean, so I had a lot more internal stitches, and they had to cut it up quite high. So yeah, I was quite uncomfortable. Found getting in and out of bed to be horrible, but I was left to my own devices, and was just trying to get on with it really. With being on the 5th floor and being sort of left to myself, I remember it's the middle of the night and needing to go to the bathroom, and I'd been used to having the catheter back in, but not this time, and I needed to go, and I was in so much pain. Like, I obviously was due pain relief soon. Was taking it orally by then. It was no longer through the drip, and I just couldn't get to the toilet, and I was starting to panic, and I had got some urine on my sheets. I was so pissed off at myself, really angry. I don't know why. I was just really angry and upset about it. I did get to the bathroom, but one of the staff members came in, saw that I was upset, and she said, it's not a big deal. Like, we'll just get you some fresh sheets. Let's get you changed. It's not a big deal. But I was psyched it out. I said, this is bullshit. I'm an adult. I don't wet my pants. Like, yeah, just I don't know. It just all came to a head, and yeah. When I think about it now, I mean, geez, what I've been through. Get over yourself. But yeah, I felt really pissed off at the time. So that's fine. That's the story about how I got some piss on the sheets. But yeah, so I don't know what she put down on the notes, but the next day I had some psychiatrist guy come in, concerned about my mental health. I said, it's coming up to day 3, and you could have the day 3 blues. I think you might be getting postnatal depression because you seem to be getting upset a lot. And yeah, I was actually quite blown back by his remarks. I said, oh really, you think I don't have the right to be fucking upset? What? Like, I said, I'm just trying to get my head around the fact that a couple of weeks ago I was just pregnant, cruising around, living my life. I'm up here now, being critically ill, my baby's critically ill. I might not take my baby home, and I might not be getting all the things that I thought we would be getting this year now. Like, my whole dream that I had for the last, 5 months is gone. Like, you expect me to just, oh well, zippity doo, and get on with it? Like, I said, fuck off. I'm allowed to feel upset. you know what? I do feel upset. If you have an issue with that, put that on your fucking piece of paper and get out. Um, he sort of really didn't know what to say, but I was a little bit offended. Like, I don't have any issues if I did have mental health issues or whatever, but I felt like they were not very understanding, or he was not very understanding. I felt like I had every right to feel a little bit upset without it being stigmatized as, oh, she's got postnatal depression. Like, nothing against people who do. Um, and a lot of people get it, but I felt like it was a little bit too early to decide if I had that or not. Like, I'm grieving for everything that I've just lost. We were going to go to antenatal classes. I was going to have, the natural birth, and I just had to let go of everything that I thought was going to be. And everybody expected, well, no, not everybody expected, but I guess some of the psychiatrists up there expected that I would just accept what's happened and get on with it. And yep, I had a little bit, but I still felt like I had a right to be a little bit angry and a little bit fucked off. Um, yeah, I've been robbed of, well, we have both been robbed of how we thought it was going to turn out. And yeah, that was our first pregnancy. And well, our firstborn child is critically ill. Like, yeah, I felt like I just needed some space after that. I just needed some space. It was probably after a couple more days of monitoring. I think I was actually in hospital for about a week after the birth, just being monitored before being sent home. So I was sent home, and our little girl was still in NICU. And she was in NICU for 97 days, I believe, or 95 days before she passed away. So we lost her in the end. But she put up a good fight. She really did. And she grew to the size of a full-term baby. We are forever grateful for every second we got with her. She was such a cool person. She had such a huge personality. And we just adored her. And I believe she adored us too. Yeah. But that was basically, without going into all of the NICU journey, could write a book on all of that. That's my pre Eclampsia story, basically. That's how I had my experience. I know it's a little bit different in New Zealand to other countries on how all of that's handled, and how all of that's paid for. That was all paid for under the public health system here. So we're very fortunate in New Zealand to not need private medical insurance to be entitled to hospital grade care. Our daughter's NICU care was all paid for. So we were pretty lucky on that side of it. I don't know, and I feel like the whole experience really has changed my life. It's changed the way I look at life. As a young person, you kind of feel like you're entitled to live, you're entitled to be here, and you die when you're old, and all that sort of stuff. And I think all of that has made me realise you're not entitled to be here. That you may die tomorrow. That nothing is promised. So it's been an interesting experience. It wasn't until I think 6 weeks later I met the surgeon, and it was the surgeon talking to me and said, "You are very lucky to be walking through this door today. You know that, don't you?" And I said, "Oh, I wasn't 100% sure on everything that I went through." I said, I'm here, yep. And I probably am really lucky to be here. And he said, yeah, that, you know, with all the conditions that I had, how much pressure they were under. Yeah, he said that I'm one lucky girl. So I kind of left there that day feeling a little bit surprised, actually, that he had said that. I figured, you know, they see that sort of stuff all the time. But yeah, and they probably do. But just the way he worded it to me, it sort of brought me back down to shit. Okay, I am lucky to be here. Yeah, he sort of brought it into perspective for me. Yeah, it was an interesting journey, and I've since gone on to have 2 healthy children. I've been monitored closely during those. My second child, her name's Natalie, another little girl. She was born at 36 weeks via C-section, and she was perfectly healthy when she arrived. She had a little bit of jaundice. She did well, was closely monitored, started to develop a little bit of a high blood pressure, just started to creep up, and the protein started to creep into my kidneys. So they decided then, let's take her out. You've got 36 weeks, baby's healthy, we're not taking the risk. Just with how fast the HELP syndrome came on, they didn't want to put me at risk again, so they took her out, and I think it was a good decision. She was a month early, but she was great. And then, yeah, a few years later, I've gone on to have another little girl. Her name's Olivia, and she was perfectly healthy, and she was actually born at 38 weeks. She made it all the way through. And they said 38 weeks for me will always be full term. They didn't want me to go any longer than that, with the risk of going into natural birth. Sorry, my phone. Yeah, so that's that basically. Didn't develop pre-eclampsia with Olivia at all. Was closely monitored, and was fortunate enough to have the same midwife all the way through, which was lovely, because she always had my back. She knew exactly what care I needed, and she took me seriously if I had any concerns. So yeah, pre-eclampsia changed my whole life, for the better, I believe, I suppose. I mean, what can I say? My life is what it is, and I feel like I definitely learned a lot of lessons with the experience that I had. It's changed me as a person, and it's made me realise what's truly important. It's not all the stuff around me. It's nothing. It's the connections that you have, your friendships, your family. They're what's important. So yeah, I don't think I took any of that stuff seriously, or my own life very seriously, until going through that. So thanks for watching.